Welcome to a quiz session on best practices. All of you may have attended various sessions. Let us now summarize all the sessions we have learned so far in the 5 sections through an activity. This will help us gain a deeper understanding of the best practices in the labor room. So, are you ready for a quiz? Okay. We will first begin with a small discussion on do's and don'ts. I will read out some practices and you have to reflect on whether it is a do in the labor room or a don't. Perineal shaving. Let us take a moment to reflect. Do you think it is a do or do you think it is a don't? Yes, this falls under don't. Routine enema. What do you think? Is this a do or a don't? If you think it is a do, then you are wrong. It is actually a don't. Restriction on diet during labor. What about this? Is this do or a don't? If you think it is a don't, then you are absolutely right. It is a don't. Exclusive breastfeeding. Now tell me, is this a do or don't? Right. Once again, if you think it is a do, so it is a do. Exclusive breastfeeding improves the health of baby. Delayed clamping and cutting of cord. What about this? Is this a do or don't? If you think it is a do, then you are very right. It is a do. Checking placenta for completeness. What do you think about this one? If you think it is a do, then you are very right. It is a do. Control cord traction in relaxed uterus. Now tell me, is this a do or don't? If you think it is a do, then you are wrong. It is actually a don't. Control cord traction should always be done in the contracted uterus. Milking of cord. Is this do or don't? If you think it is a do, then you are wrong. It is a don't. Milking of cord is not needed. Delaying baby's first bath. What do you think about this one? If you think it is a do, then you are very right. It is a do. Postpone the bathing of term baby for at least 24 hours and at least for 7 days for preterm and low birth weight babies. Allowing companion with mother. Is this a do or don't? If you think it is a do, then you are absolutely right. It is a do. By keeping birth companion with mother, mother feels relaxed and chances of complication in mother are reduced to a great extent. As you can see, there are multiple practices under do's and multiple other practices under don'ts. It is important for service providers to know which practices are good to follow and which are not. Each time you wonder whether to do or not to do a practice, take a moment and classify it under do or don't and accordingly take action. Now let us look at some statements and reflect on whether it is a yes or a no. There are a few categories under which I will make these statements. First, let us talk about the danger signs in newborn that we need to look out for. And you have to reflect on if you think this is a yes or a no. Baby's birth weight of 1500 to 1800 grams. What do you think? Is it a danger sign or not? If you think it is, then you are very right. Yes, it is a danger sign. Birth weight less than 2500 grams is low birth weight. Not suckling after 6 hours of age. Is it a danger sign? If you think it is, then you are absolutely right. This is a danger sign. Small baby feeding well and gaining weight adequately. What do you think about this one? Absolutely right. If you think it is no, it is not a danger sign. Fast breathing, more than 60 breaths per minute. What about this one? Yes, very right. If you think it is a danger sign, yes, it is a danger sign. Grunting. Is this one a danger sign? If you say yes, then you are absolutely right. Eyes swollen and draining pus. What do you think about this one? If you think it is a sign, yes, you are right again. Yellow skin on face and less than 24 hours old. What about this one? If you think it is not a danger sign, then you are wrong. Actually, this is a pathological jaundice and it is a danger sign. Less than 10 pustules. What do you think? Is this a danger sign? No, more than 10 pustules is a danger sign. Fever, temperature more than 38 degrees Celsius. Is it danger sign or not? Yes, this is a danger sign. So give yourself pat on the back. This is a danger sign. Now you know which are the danger signs in newborn and which are not. This way, you will be able to take the right action in case you observe any danger signs. Now, we will talk about the appropriate assessment of fetal and maternal conditions, and you have to tell us if you think this is a yes or a no. Taking medical, surgical and obstetric history. Is this appropriate assessment of mother? If you think it is yes, then you are absolutely right. Recording mother's blood pressure. What about this one? Is it appropriate assessment? If your answer is yes, then you are very right. Recording mother's temperature. Appropriate assessment or not? Yes or no? The answer is yes, it is an appropriate assessment. Recording fetal heart rate. What do you think about this one? Yes, fetal heart rate has to be assessed. Internal examination should be done frequently. Is this appropriate? No. Ideally, PV examination should be done every 4 hourly unless indicated otherwise. Cleaning of perineum with antiseptic solution is not required. Is this appropriate assessment for mother? No. Perineum should be cleaned with antiseptic solution before any aseptic procedure. Now you know what are the practices for appropriate assessment of fetal and maternal condition. You know which ones are yes and which ones are no. Now we will talk about practices under essential newborn care, and you have to tell us if these need to be carried out or not. Baby needs to be received in tray. To be carried out or not? No, baby should be received on mother's abdomen. Start breastfeeding as soon as possible after birth. What do you think about this? If you think it is not to be carried out, you are wrong. Breastfeeding has to be started immediately after birth. Injection vitamin K should only be given to low birth weight or preterm babies. Is this correct? No. Injection vitamin K should be given to all newborns. Suction needs to be done with every newborn. If you think answer is no, then you are very right. Routine suctioning of all newborns is not needed. Preterm baby requires size 0 of mask with embu bag. Is this correct? Yes, you are right. Size 0 mask with embu bag to be used for preterm baby. Skin to skin contact is required for all normal babies. If you think the answer is yes, then you are right. Now you know what practices fall under yes in essential newborn care and which ones are a complete no. As you would have seen, we need to be vigilant on what is permissible and what is not permissible, what practices we should be doing and which we should not be doing. Now, we will have some miscellaneous statements and we will reflect on if it is a yes or a no, or take a look at one-word short answers. All pregnant women need to be given antibiotics prophylactically. What do you think? Is this yes or no? If you think it is a no, then you are absolutely right. Antibiotics should be given in indicated cases only. What is the measure to prevent deaths due to preterm births? What is your answer? It is antenatal corticosteroids. In preterm delivery, injection dexamethasone should be given to the newborn. What do you think? Is this yes or no? If you think it is a no, then you are absolutely right. Injection dexamethasone should be given to pregnant mother, not newborn, in threatened preterm birth between 24 to 34 weeks of gestation. Minimum duration for KMC. What is your answer? It is 1 hour. How many minutes before delivery radiant warmer should be switched on? Your answer? It is 30 minutes before delivery. Newborn resuscitation can only be performed at NBSU or SNCU. What do you think? Is this yes or no? If your answer is yes, then you are wrong. Newborn resuscitation can even be performed in labor rooms or OT at newborn care area. Now we have arrived at the last part of this session, where I will take you through a few important messages from the sessions on PPH, hypertensive disorders of pregnancy, obstructed labor and infection prevention. What percentage of maternal deaths due to PPH can be averted? What is your answer? It is around 66%. What is the single most important measure to prevent PPH? What do you think is the answer? It is the active management of third stage of labor. What are 3 critical steps of AMTSL? Your answer? The first step is giving injection oxytocin 10 international units intramuscularly within 1 minute of delivery after ruling out other baby. The second step is delivery of placenta through control cord traction. And the third step is feel for the uterine tone, and if the uterus is relaxed, then massage uterus. What percentage of maternal deaths occur due to severe preeclampsia or eclampsia? What is your answer? It is 14%. What are the criteria for assessment of preeclampsia and eclampsia? Your answer? It is blood pressure of equals to or more than 140 by 90 millimeter of mercury, protein urea, danger signs for severe preeclampsia and convulsions for eclampsia. Single most effective treatment in severe preeclampsia or eclampsia. What is your answer? It is injection magnesium sulfate. Can we prevent obstructed labor? What do you think? Answer in yes or no. Yes, we can prevent obstructed labor. What is the simple tool to identify obstructed labor? Your answer? Yes, of course, it is partograph. When health workers should start filling partograph? What is the correct answer? It is from active phase of labor when cervical dilatation reaches 4 cm or more. How many minutes instrument should be dipped in bleaching solution for decontamination? Your answer. It is 10 minutes. What are 6 cleans? They are clean hands, clean surface, clean perineum, clean cord cut, clean cord tie and clean dry cord. PV examination should be performed every hour. Is this statement correct or not? No. Ideally, it should be done every 4 hourly, but depends on situation also. Here we have reached the end of quiz. I really hope that you all must have enjoyed this activity. All these do's and don'ts, yes and no's, and the questions with appropriate answers are available as a ready reference in your session folder. So, all you need to do is go back to the presentation for a quick read in order to know exactly what you need to do in the labor room. I hope this enables you to provide the best healthcare service in your facility for mothers and newborns. Thank you.